Welcome all, this is my YouTube channel. I am speaking Dr. Hasib Namaskar. In my today video, I will tell you about the recent new development in the coronavirus vaccines. As we know that the pandemic started and there is a lot of vaccine which are approved and nowadays using successfully, but there is some improvement in these vaccines, and nowadays there is a new vaccine Mrna1073 which are in clinical trial study. So this Mrna1073 is a unique character that it has both the previous messenger RNA technology, and also in additionally it has flu vaccine also. So it is the combination of both flu vaccine and messenger RNA coronavirus vaccine. So what is the combination? This is the new combination, Moderna mRNA1073 plus flu hemagglutinin glycoprotein booster shot, and this shot which is now being studied by the scientists in phase 2 trial. So before we are going to look at the advantage of this vaccine, we also see that when we are giving the messenger RNA booster shot, it create a robust antibody response about 40 times more against Delta virus variant. So it means that it produces 40 times robust antibody response against Delta variant. So there is another besides this vaccine, there is another vaccine, adevector 5-ncov. The brand name is and this candidacia or Ad5ncov. This is single dose vaccine, and now the scientists are developing nasal spray of this vaccine which is equal to the intramuscular single dose equal to the 2 nasal sprays, means this is the 1/5 part of the intramuscular injection. So this is the nasal spray vaccine which are coming in these days. And there is another advantage of another new vaccine, or there is improved vaccine which are in clinical study, and the researchers in Canada has developed an adenoviral vector based vaccine against coronavirus disease that induced robust immune protection against the ancestral strain of severe acute respiratory syndrome coronavirus. The potential next generation vaccine candidate also induced robust immunity against the UK variants, South African variants, and the Delta variants. Furthermore, the researchers showed that the respiratory mucosal administration of the vaccine was superior to the intramuscular route and inducing 3-armed immunity, including local and systemic antibody response, mucosal tissue resident memory T cells, and mucosal trained innate immunity. So what did the researchers doing in these type of a new vaccination using adenoviral technology? The researchers developed adevector trivalent COVID-19 vaccine that expressed the original spike protein subunit S1 as well as the highly conserved T cell antigen nucleocapsid protein and RNA-dependent RNA polymerase. The team evaluated the effectiveness of the next generation vaccine strategy following a single intramuscular or intranasal dose in the murine model. So it means that this new trivalent adenoviral based vaccine is also a nasal spray vaccine. So this is a good advantage. And what are the advantages of this vaccine? The researchers showed that the single respiratory mucosal immunization via the intranasal route of this vaccine, particularly with the adenoviral vaccine, induced the potent neutralization antibodies both locally and systemically. Importantly, intranasal immunization elicited respiratory mucosal tissue resident memory CT8 plus T cells and trained resident alveolar macrophages. The overall mucosal immunity conferred robust protection against not only the ancestral strain of the coronavirus but also against the UK variant and the South African variant. So these are some great advantages of these new type of vaccine which are introducing in these days. And the main thing about this vaccine, these are intranasal vaccines, adeno-vector based vaccines, and the messenger RNA vaccine, Moderna vaccine, which are developing what we call Mrna1073, is a double vaccine having flu shot and messenger RNA vaccine. So this is as I said, the next vaccine is adeno-vector based vaccine, which is full advantage in this pandemic. So these nasal vaccinations are very advantageous, and especially in the term of adeno-vector trivalent vaccines and messenger RNA double vaccine, which contain flu shots and messenger RNA coronavirus vaccination also. Thank you so much.